The easiest way to get your cholesterol down is to watch what you eat.
Ever wonder what a 104-year-old heart surgeon ate and didn't eat to keep his heart healthy for over a century? Dr. Ellsworth Wareham believed just 5 common foods were causing chaos in our hearts. Could these foods be affecting you too?
Throughout his life, Dr. Wareham was a remarkable inspiration and loved by many. He tirelessly worked as a cardiac surgeon until the age of 95.
Today, we're delving into the dietary secrets of Dr. Ellsworth Wareham, a founding cardiothoracic surgeon who lived a full, exciting life up to 104. Known for his dedication to a heart-healthy lifestyle, Dr. Wareham maintained by avoiding 5 specific foods he believed were destructive to our health. So, if you're interested in which foods could be harming your heart and what options might protect it, stick around. This video could change the way you look at your meals forever. So, let's start with the first food Dr. Wareham avoided like the outbreak dairy. It's a big part of most diets: milk, cheese, butter. But Dr. Wareham believed that these foods weren't as healthy as they seem. Why? They're packed with saturated fats and cholesterol, 2 things he saw direct as contributors to heart problems in his patients.
If you can keep your cholesterol under 140, your chances of developing coronary disease are very small.
Milk protein, casein, can even raise cholesterol. These saturated fats and cholesterol can increase LDL cholesterol, clogging arteries and raising the risk of heart disease. Moreover, studies suggest too much dairy might be linked to higher risks of cancers, particularly prostate cancer in men. Dr. Wareham believed these long-term risks overshadowed any benefits, so he avoided dairy and instead sourced calcium from plants like leafy greens, beans, and lentils. Beyond fat and cholesterol, dairy can also lead to inflammation, which has been linked to several chronic diseases, including heart disease. By avoiding dairy, Dr. Wareham reduced his inflammation, supporting his heart health well into old age. Dairy can also cause digestive issues, especially in those with lactose intolerance, which leads to bloating, gas, diarrhea, and discomfort. Even individuals who can digest lactose might find dairy hard to process due to its complex protein structure. Some studies also suggest dairy could trigger autoimmune responses, possibly leading to conditions like type 1 diabetes and multiple sclerosis.
And one of the factors is the amount of saturated fat, and most animal fat is saturated.
Dr. Wareham also avoided saturated fats, commonly found in foods like red meat, butter, cakes, chocolate, ice cream, and cheese. Could avoiding these irresistible treats be the secret to a healthier heart? What if a small change could significantly lower your risk of heart attacks and strokes? These fats raise LDL cholesterol, which can clog arteries, potentially causing heart attacks, strokes, and other cardiovascular issues. His extensive career as a heart surgeon showed him directly how poor dietary choices lead to clogged arteries and life-threatening conditions like coronary artery disease. Rather than saturated fats, Dr. Wareham chose plant-based fats from nuts, seeds, avocados, and olive oil, which are high in heart-healthy monounsaturated and polyunsaturated fats. Saturated fats don't just harm heart health. They're also linked with insulin resistance, a condition that hampers blood sugar regulation and increases the risk of type 2 diabetes. Research shows that diets high in saturated fats weaken insulin receptors, making it harder for the body to manage blood sugar. They can also increase inflammation, a factor in conditions like arthritis, asthma, and certain cancers. Additionally, high levels of saturated fats can lead to liver issues like non-alcoholic fatty liver disease, NAFLD, and even contribute to cognitive decline, potentially increasing the risk of Alzheimer's. The third item Dr. Wareham cut out was sugar. From desserts to sodas, sugar is in almost everything these days. But Dr. Wareham saw sugar as a major reason for chronic diseases like diabetes, obesity, and even cardiovascular issues. He believed that cutting back on sugar was a great way to protect his long-term health. Dr. Wareham avoided sugar to protect his health from the many risks sugary foods can bring. Eating too much sugar raises blood sugar quickly, which can make people feel tired and hungry soon after. It also adds extra calories, often leading to weight gain, which puts strain on the heart and can lead to heart problems over time. When we eat a lot of sugar, our body must produce more insulin, the hormone that helps control blood sugar levels. But if this happens too often, the body can start to ignore insulin. This condition, called insulin resistance, can be the first step toward type 2 diabetes. Beyond diabetes and weight gain, high sugar diets have been linked to other serious issues. Studies show that too much sugar can affect mental health, causing mood swings and increasing the risk of depression and anxiety. Sugar may also speed up skin aging, leading to wrinkles and dullness. It can even impact the brain, potentially causing problems with memory and learning over time.
There are a lot of people that take too much salt, and their food they think is flat unless they have a lot of salt in it.
Imagine sitting down to a meal and adding that extra pinch of salt, thinking, just a bit more for flavor. It seems harmless, right? Yet, for Dr. Wareham, salt was more than just a seasoning. It was something to avoid completely. Why? Because while salt adds taste, too much of it can have serious concerns for our health. When we eat a lot of salt, it causes our body to hold on to extra water. This extra water increases the volume of blood flowing through our veins and arteries. With more blood pushing through, our heart must work harder to keep it all moving, putting strain on both the heart and the blood vessels. Over time, this increased pressure is what we call hypertension, or high blood pressure, which is a major risk factor for heart disease and stroke. High blood pressure isn't just a number on a chart. It's a silent condition that often has no symptoms until it's too late. It quietly wears down the walls of blood vessels, making them weaker and less flexible. This puts us at risk for blood clots and other heart-related problems. Dr. Wareham avoided processed foods, which are normally high in sodium, in favor of fresh fruits, vegetables, and legumes, which are naturally low in salt. The World Health Organization advises less than 2 grams of salt daily to reduce heart disease risk. Gradually lowering salt intake allows taste buds to adapt without sacrificing flavor. Excessive salt also affects kidney and bone health. When sodium levels are too high, kidneys struggle to filter it, leading to hypernatremia, excess sodium, and possibly kidney damage. High salt intake can also decrease calcium absorption, increasing osteoporosis risk, especially in older adults. The last food Dr. Wareham avoided was processed oils, often found in fried and packaged foods. These oils are highly refined and low in nutrients, and many contain omega-6 fatty acids, which in excess can cause inflammation. Processed oils are common in modern diets, found in dressings and baked goods. The refining process creates trans fats, which are particularly harmful, raising the risk of heart disease. Even some vegetable oils marketed as healthy can upset the omega-6 to omega-3 balance if overconsumed, promoting chronic inflammation. Instead, Dr. Wareham chose whole food fat sources, like avocados, nuts, and seeds. Dr. Wareham's food choices show how much he knew the link between what we eat and our health. By avoiding dairy, saturated fats, sugar, salt, and processed oils, he lowered his chances of getting chronic diseases, specifically those that affect the heart. His choice to cut out dairy points to the possible risks of saturated fats and cholesterol, while his caution about sugar and salt focuses on how they can harm our metabolism and heart health.
Exercise is beneficial in reducing your cholesterol, but if you're taking in a considerable amount of saturated fat, you can't exercise enough to lower it as much as it should be lowered.
Dr. Wareham's careful eating habits helped him stay balanced in his heart health and overall well-being. His lifestyle offers helpful lessons for anyone wanting to improve their health through food, reminding us that making smart choices can lead to a longer, healthier life. And here's an extra tip. Keep a food journal. Writing down what you eat can help you stay accountable and make better choices. It's a simple yet powerful tool to help you track your progress and stay motivated on your health journey. So, next time you eat, think about how your choices compare to Dr. Wareham's advice. What small changes could you make to take care of your heart? Remember, it's not just about living longer, it's about living better. Thanks for watching. If you found this helpful, share it with someone who could use some tips for a healthier diet. Until next time, eat good food, live well, and take care of your heart.